We are still discussing no bed syndrome in 2026. How? Recently, young engineer Charles Emisa Onokrano Watson and Nano Bonsedo Adanya 3 major hospitals over in the bed in Niho. As some way generating conversation and no crown copiemu our parliament. Now Alban Bagbin are Speaker of Parliament. Ono nebusia ne approach our parliament do ejagunichim ewo hono ekodu headquarters matumebo na megiga inseminemu into details na me breaking it down. Kindly subscribe to Trends GH on YouTube, Facebook and TikTok bibia Trends GH. At times no what na say na no de wo kai say wo ya Ghana ni a ebi o wa na ye wo sesu ebi so ho ma na ye wo sa eya dan a enigisem ewo bebi kakra na eba na ye hospital ho sensem a eya hwe ho sam kese pa ema oman Ghana won ti ase until the day ebi ebeto eye wubusuani asa ebusua wode wo ho ebehye amanfo shoe so ebe no bed syndrome say obi yare bebo no anase emergency beto no mo ba rush de kopie mo hospital na no de doctors anase nurses be kire say bed eni ho erinti sa nipa no de wepra ohia eye attention no omuntumi admit no na asamba akwa no de esiye about weeks ago young engineer Charles Emisa nipa bonifo bi edeka ebo no eno de omugya no wo ho a eno de nipa papa bi ekohu na orash ne kopie mu ewo major hospitals eno de omukyem say bed eni ho enu ti abrantia no ohwere no kwa eno na asam no ekopie mu parliament a eno de ebusua omo discuss this no bed syndrome no deputy health minister Dr. Grace Ayensu eno de ekopie mu ho a ebusua conversation others share so about no bed syndrome eno de Charles Emisa watch na no won say do ni di ebepie mu no eno na Alban Bagbin kra no edru baby no na ochre minister deputy minister no say debi asam no eyesa wo ya politics and ebi just say debi or can the reality on grounds.
Mr. Speaker, the event that led to this unfortunate incidents and demise of the gentleman is tragic and should not happen. Under no circumstance, Mr. Speaker, should a human being die this way. Mr. Speaker, however, governance is a continuum. However, Mr. Speaker, the conditions under which the current government came into running the country, Mr. Speaker, was rather dire when you talk about our health system. The previous government started the Agenda 111 project, Mr. Speaker. Agenda 111 at the end of 8 years, Mr. Speaker, there was not one single hospital. I'm not engendering debate. I'm just trying to explain the circumstances. Mr. Speaker, Agenda 111, at the end of 8 years, Mr. Speaker, there was not one single hospital that was operational. Mr. Speaker, in fact, what we came to meet was multiple hospitals littered around the country, some of them at foundation level. There was not one hospital that a human being could walk in. However, they had spent millions and billions of Ghana cedis.
Honorable Deputy Minister, please focus on the major issue.
Thank you, Mr. Speaker. I am guided.
Alban Bagbin, I know what say. Deputy Health Minister, me bisa a question. Na me hear answers, yes or no. Deputy Health Minister, answers are also this time or sign day mano.
You are a Deputy Minister of Health. Do you need a bed to attend to emergency situation?
Thank you, Mr. Speaker. By definition, Mr. Speaker, an ambulance itself is a bed. An ambulance is what we classify as a step-down unit. The cart in the ambulance can be considered a bed. So in such cases, a patient can be treated in the ambulance.
Yes. Even outside the ambulance.
Exactly.
Outside the chair. Even at the ward. do you need a bed to attend to an emergency?
No, Mr. Speaker, the patient
So let's
can
move
actually
on, please.
be
Let's
treated.
move on.
Yes, the
Let's
patient
focus
can
on the
actually be
issues.
treated. They need to have the proper equipment in the ambulance, Mr. Speaker. In the
Honorable
ambulances,
Deputy Minister, I was a Minister for Health. I know what I'm talking about. Please focus on the issue. The reason was that no bed. That is
Thank
what
you,
we've been
Mr.
told.
Speaker.
So focus on that. You've done well by establishing a committee to investigate the issue. So let's look at it seriously.
Thank you, Mr. Speaker. As a ministry, we are taking every step to ensure that such situations never happen in the country.
After that, Speaker of Parliament, Attacks Alban Bagbin, cracked them, we say, I was sending when you a parliament, or Muya Bibi. I know the normal person, Moya say, or demanding a emergency care law. Send a bear, able to me, I solve that situation. I know that I obi ko hospital, I see no bad syndrome, no bad syndrome. No, send your mouth watcher, my young much monka highway no soon. Oh, as a never drew Kevin and Kobe Taylor. Ibradango, headquarters, I watch him say. Attacks Alban Bagbin, someone or Kayano, obey you no. But what there any money me on share intro nasa. I manum the minimum kakra. Kevin Taylor or Cassani Munebusia. Ochem say, even the ambulance service. Who go pay more Bono region? The whole region, who ambulance service or more officer.
Sad death of the young man, it is because of the negligence of our politicians. The reason it is because politicians, you people have failed us. No bed syndrome. I don't in America. Have you seen a private citizen, an American citizen, buy beds to go give to hospitals? Have you seen American citizen equipping hospitals in America? Mutina Ghana, instead of you people to be honest and have a conversation which is politics, it is only politics that can solve this problem. Nana Dankwa Akufo-Addo and the MPP came into office for 8 years. Can you tell me one hospital that they equipped? Omutumi, a revival hospital, no, Emma hospital, no, Ebenya more beds. Can you tell me one? Then the woman starts to speak about politics because politics, Emma Brantia Wewu. And your politics are and can't na kroma Emma Abain Bediso for 8 years. Say we are hospital, Yanfam Pabaku. Are you crazy, you people? Say your politics are and Kafari Hospital, Yantina Ghana, Yanka say we are not going to open it. It is politics. You people should take the blame for your negligence and your greed. Moya would for one kind of majority of you. When you people are sick, we fly you out of the country, you go and enjoy, you come back and make us look like, say, Jimmy. The deputy health minister was telling you people the truth. It is only politics that can get us good beds in our hospitals. Ambulance services, this is their current state. Akufo-Addo Bagbin, a day no more ambulance services.
Ghana National Ambulance Service, Bono Mantem, original office. Na sa edawe Ghana Fire Service. Womo dani bi e no mediama ambulance service say regional office. Na enye region fonko a ene wa ha. Sunyane municipal ambulance service. Womo so e wa ha no bi. Eno echi so no. Wo behwe dan no kra no a dan kra miensa. Make say 3 rooms. And now ama region for no. Staff no ba ha no mo a. Senye mangudiana sino mekwakwatena agi se omotena corridor no so sa fitia no pa kosi se omo bepon pepacho officers 4 enewa ha regional secretary ewa ha procurement so desk na mejire nimi na your regional finance also wa ha na the whole overall regional commander driver so tia so this small office space here officers 4 ene occupy ha officers 4 and occupy. It's too small for us. All other services are regional procurement or an office, finance or an office, so that we are helping the country. We are here Bono region. Spaces here we require fast service for down on the money. In fact, I have so send America. I also officers. 3 and officers now senior officers. In fact, year 4 and 4 and regional transport officer.
Me and make us say me regional head clinical auditing. Me tia. Unfortunately for us, regional head of training on Otiwe or Sansu ye piano or so in this small office no the Sansu regional IT and these are senior officers. So this small office here we send a call no one also here for send a mechanic your head training or head clinical auditor or head transport and a head IT. This is the space we occupy. How can we serve Madagascar with this small space?
This is what we've been talking about. In some area, can be ni ambulance service no. Shall be omu free. Ekufu ade koto ambulance we buy ye ni office mo. Ambulance ekufu ade koto buy ni nyina say. Na wo Alban Bagbin what one ye ka kire wo say. Ade na ekoso no. Mama yemfa politics and solve a problem na mo say this is not supposed to be political. Na mo djuma na mo to mo de so ye den. I'm not holding brief for any nurse. Ye nim say nurse for ni bi nye. Ye nim say djuma na mo ye nso ani. Na me nurse na mo hospital na empa ni wa den na menye me nurse in your hospital. I am not holding brief for any nurse. At least they were supposed to administer at least first aid, try to at least save the patient. But the issue is here is at the end of the day, because the patient way na me never trouble ntene na me ntumi save na one of masaka say hey na Ridge Hospital for na police hospital for omoji depend on me ko tra akonwa so na wawu na nkede to mpa so anko owu anya mo na nka mo betra police baka sanko asem no sanka Ridge for police hospital for edge abrantie no and on the two benches so and a moja junu na because you cannot put somebody on a bench and put drip on them for blood to go through them perfectly. Now omo to bench so and a moja ni call muna owu ya kamobeka said nurse for ne kuno. Now if I don't think nurse ni bia be free fie doctor ni bia be free fie aka kire no say they will be banner say impact wo ho me mani pani nya bin so nda. I don't think anybody will do that. So you people should be rational a little bit. It is politics. Yet to Chroma de Biania Casa UGMC, a nice hospital. Politician Yara Nakoto, Quasiafo, Sa a Hondian Mahoya nice hospital. I am Paya Togumu. People bought beds in Papa Gum and Nintino Bia Pesokoda UGMC. Sankobia Bessia and Fampanguma and Cabenio Manasokoda. Your responsibility is to use politics to change the lives of the people. Mumienga Saka Satan Tina Moyano Parliament. People are dying. Tonight, as I speak, Obia was Ankrewa, Ade Onia Kranti Ante. Menoka say obi ewo sirem onye nkran ti wamba region ti ante obi ewo bono region wamba nkran ti ante. Do you know people who are dying and you are telling me that this lady should not make it political? What should we do? Instead of you people to take the blame, no must see hospitals nemra no be there ba no. These hospitals, I'm asking you, these health facilities, Kolebu, Ridge, any police hospital, in Kwasiafo, Yatigana, Yakwa Brocha, Yehu hospital, how it is, how it looks. Yakwa Brocha hospital na ho no ye hu bi adenti enye Kolebu sa adenti na yenye Ridge hospital said the DC the New York City adenti na yenye ne say ya Brocha adenti ba Ghana dia that we want to blame the health practitioners, give them the tools to work. You people sit in parliament ne atam V8 amamo ne amamo common fund ne atam salaries akesia amamo na mo to committee so na mo je pedi am kwasiasam. You people are making money out of us. Make sure those hospitals are built, make sure the beds are in. It is your fucking job. Stop pushing the blame on the people. What should these people come and do? Doctor Nia Empani Hospital, dear no one. What is he going to do? Dear no be. Nurse Nia Empani, what dear no be. Sir empower ho, na nurse no and neglect so the nipa betuswa. We have the responsibility, we have the right to sack the nurse. Or sometimes prosecute them. Now, Ridge Hospital calls enough beds or what? Kolebu calls enough beds. You don't have it, and you are summoning them to come and do what? The nonsense you are dealing with in Ghana. When it's for you people to accept that you have failed the people, you want to change the topic and make it look like Jimmy and that the hospital is the problem, the doctor is the problem, the nurse is the problem. We admit it. We have foolish nurses, some foolish doctors. Qualifying to be nurses and doctors. We understand, but we are not going to take this blame. This man died because of you people. His blood is on Parliament.
After Kevin Ekobenu Taylor, the introduction when Ochim said. Alban Bagbin, Sir Embra, I don't know the Parliament and pass which is a emergency care law, your hospital. Our message, Emma Alban Bagbin. Message, Senior Kevin Taylor, when descending on Alban Bagbin, Nifugu, and then a spectacle crowd, a mess call.
Yes, sorry, yeah. The Speaker of Parliament to say, Speaker demands emergency care law after engineer's death sparks national outrage. We don't need any law. Alban Bagbin, listen. Your arrogance. You sit in Ghana and nobody should speak about you. You think you know every knowledge in Ghana. You don't. We are the people who are suffering. When you were sick, you were flown to South Africa to get medical care. There were heads, there were beds there. You enjoyed. That's why today you are living. You would have been dead. So you people should stop this intimidation in Parliament.
Thank you, Mr. Speaker.
How can you look at no bed issue without being political about it? Alban Bagbin behind him so nimnyansa chen obia o Ghana. Mo obia nkana asem. He speaks and that's it. He's the god of politics. We are talking about beds. Now beds na sifunu. You, Alban Bagbin, how many beds have you bought for Ghana? You have been a health minister before, so what? You are a disgrace to Ghana. You are a disgrace to your colleagues, your age group. You are supposed to champion this and say, yes, we politicians, we have failed the people. You have sat in Parliament how many years? And you sit there and you tell the lady that, yes, focus on the bed. The bed is a full room. When you see hospital, I better not go to Panaba. Ghana for you see hospital. And you see Ghana mujidisi. Oh, yari now called Dubai, no. Now that patem. You are protecting yourself. You are protecting your criminal friends. You are protecting the money you will make. You are not thinking about the Ghanaian now. Tonight, you Alban Bagbin, you are a northerner. Go to the north. You sit in Parliament, and Parliament. You are being a minister. And so what? You Alban Bagbin, you can't they open also on Saka. You hijack Parliament. You decide what should go on, what shouldn't go on. This guy, Kojokum, mo need to ambulance mu begina Parliament. All because on Betwaba. You people. Namo Twaba, on Betuma MPP. Enya power. Now what the Parliament? Ya tamune de netina wheelchair mu de netina ambulance. How many people are privileged to get into an ambulance in Ghana? You are a very selfish old man. You Alban Bagbin. Very greedy man. You have been a minister before, so what? You are an annoying old man. Sometimes what now Michelle Sam say, bring yourself down a little bit and learn a little bit. You don't know everything. The way we all don't know everything, you also don't know everything about Ghana politics. Young people, young parliamentarians, they fought to get to that position. Some of them even lost their seats because of that. Some people today are not MPs because they had to show their faces in Parliament to fight for you, a greedy man like you, to be the Speaker of Parliament. We are sitting there talking about life. You are saying stick to the issues. Now you can't empower some the people will charge on you people one day. Think about their needs. We sit or we were in this country. You boo a whole general hospital to go a whole general hospital. You are talking about you have been a minister before. I have been there before. I didn't want to heaven and now. So I want to go on pension and go home. Why hijack Parliament? And a father, oh father. Father, oh father. What you want? And your Parliament and your diao. Whatever we through Parliament and a yentina call Parliament. So Ukuro Mufona to Uncle Parliament those years and Kaunyo Bia. So mellow yourself sometimes and sometimes look at the issues. Nobody is disrespecting you. But you do sometimes now you may be away and bufu. It just say when I got on Panamra. Modi Kolebu Forba, Modi Rage Hospital Forba, Modi what the law neighbor, sa law we are what say. Speaker demands emergency care law. Law ni amfango ejuma way. Enti so be yare car bo be near the number rage dan pani wade enye. Law ni mfa so be na beba so. Get some practical things done. Let we have the very difficult conversations and make sure we solve the problems and stop sugarcoating and glazing and cosmetics things and sit there and make like this law, what is it going to do? It will not change the life of an ant. Into what the law we are, emergency care law. Near the obiako eye ukuro musrem na otimoto so na moto car board na moja nyunu no. Near the number ukuro musrem hospital na empadiwa. Sa law way, how is it going to apply? Doctor no, they should shit bed or they should vomit bed. Or they should run to Accra and put a bed on a flight, and the whole thing is provide the beds. The minister is telling you that is our problem. Let's have that very difficult conversation. And then I'm selfish, sir. Why are you people forgetting your principles? Why should everything be about I am the senior, I am over you, I have position? Why is it supposed to be about position and intimidation? Why are you people like this? I don't know what to be good in sir. MPP for A Caribbean nyansafo wo nisan komo ka eye health ho asem. For 8 solid years, our health sector collapsed. A collapse totally. Who Alban Bagbin, Anka Hospital, Papa or Ghana, Anka Anfuanko Dubai. Our health system, do you know the sickness nana oyarena yeduko Dubai no? There were people who are at your age, the same age or Ghana, but they are the taxpayers. Don't forget these things. Yarena ebo na because of politics. Today you are working and serving the people. No, there were people at your age a bit more. They died. So don't take that for granted. Don't make it look like you are God. Don't make it sink in your head that you can use your position to intimidate anybody. No bed syndrome is a political issue. It is only politics that can give us beds. It is only politics that can give us water. It is politics that can give us light. It is politics that can create jobs. Every single thing is centered around politics. It's a fact. Go to Nadoli, your hometown, Nadoli, and tell me there's a hospital there. Anadri Kabobi or Nadolia, Namoje Tuna, come and tell me that your law, your emergency care law, it will take care of the person. You are deceiving the people there. You are lying to them. You are in Accra and you think the Nadoli people are foolish. This is your law. This law that you are demanding, do you think it can save a life at Nadoli? How is it going to save a life when there's no bed? Who should go bring the bed? What you were supposed to do was be like left and right. Let me tell you people, today we should bring the finance minister here. Let us look at the issues. It's a political issue. That's why we have lost the young man. How are we going to solve the no bed syndrome issues now? Because it cannot happen to me. It can happen to my brother. As the leader of parliament, I want us to come today and deliberate on this until we get a solution. We are not working. Mr. Minister, tell us, you are in charge of the sector. What did you come to inherit? I inherited this, I inherited that, I inherited this, I inherited that. These are the number of beds we have. We need to augment. That is what we do. We think in parliament. We don't do seniority there. We have to be practical. We are paying you for what you are doing up there. Also, no sekente, no fugu, no address. Yes, modeling meaning we mean business here, my friend. We mean serious business. Me, I know you don't like me, and I don't care. I want you to work. We are giving you everything like a Egyptian king. Whatever you are asking for, we are giving you. What else again? You sit in parliament and tell us you are number 2, you are number 3. We get it. Do your job and save the people. You see, but more politicians now, more Ghana, no. You people have to be sometimes very careful about the way you do things. Oh. The new Ghanaian does not have patience. Oh. The young Ghanaian working there, on Jimmy you. Sometimes you people think, say, the whole 1992, the whole your politics. 90% of the young people in Ghana don't care about your name and the record you hold. They don't care. Se come dini yem. Se oyam wano. Oma adia na kuma ya obe pay you back. I'm telling you, especially these people, these young people getting access to information around the world, being able to read wide and seeing other countries, their politicians taking decisions to favor or help people like themselves in other countries. If you make a mistake, if you think, say, we are living in some hen coop, yes, a bombing into Ghana for the Jimmy. Say I no mutuaba, not only for they say I no mutuaba, Mayor Alban Bagbin, Omuhumia, they respect me. Nobody gives a heck about your titles and who you are. If you die today, 24 hours, you people still think say you are in 1992. The young people you see, say Usi hospital mana obeka till he dies. Oko na okonyema kwara na kwara ntumi ko wo efa no hofa no ba. That kid owes you. And Obekai Udebia.
Ebusan, feel free. Natural why you your comment section. Next video way. Send a beya afro so a monsa ebekebi. Macrow. Ebusan quick one. And twice a second. Number monotor from the legit source. Our wasas baby dano ubenya access to electricity, water, any of good road. Now, meno can say Land King Company Limited. Omo no more the trusted source. Ebano asasa one sama omu chema. Omo asasini mi opokuase hills. 10 minutes drive from the interchange at 70 feet by 100 feet and no call for 255,000 Ghana cedis. Sasuna more 50 feet by 70 feet and do the phone call 130,000 Ghana cedis. Sasuna more asasini bi o Ashalaja near Amasaman and also 70 feet by 100 feet and call for 85,000 Ghana cedis and a 50 feet by 70 feet and do the phone call for full 45,000 Ghana cedis. Lankin Company Limited, omo office, ewo pokwasi here, omo number, na echegu ewo screen so niti masrawa, for Lankin Company Limited, na je wasase, efu omo ho. No man su chibia.